Hello, I'm Maruk Said, your microbiology guide. Let's explore in-depth micro techniques and uncover groundbreaking insight together on this educational journey into the fascinating realms of microbes.
Hepatitis D virus, also known as Hep D virus, is a delta virus. Hepatitis B virus, also known as Hep B virus, belongs to the hepatinovirus family. They both result in hepatitis, or liver inflammation. Despite the fact that they both cause hepatitis, the hepatitis D virus need the hepatitis B virus to reproduce in order to cause the illness. The hepatitis B and D viruses are encased, meaning a membrane surrounds them. To make matters interesting, the membrane of both viruses contains hepatitis B viral proteins. Particularly, they both carry a surface antigen called HBs. There is a capsid, a protein shell with additional antigens, located underneath the membrane. The hepatitis B capsid contains HB core, often known as HBC. Additionally, there is a version of HBC called the HB envelope, or HBe antigen for short, which is not actually a component of the virus. It is secreted and present in the serum of infected people. The hepatitis D virus capsid contains delta antigen, or HDAG for short. The viral genetic material is contained within the capsid. Hep B is a DNA virus, which implies that a portion of its capsid is made up of double-stranded circular DNA that is composed of a long and a short strand, with the long strand being single-stranded in this instance. Moreover, it contains DNA polymerase, an enzyme that can convert DNA to RNA and vice versa, and has activity depending on both DNA and RNA. However, because HepD is an RNA virus, the single-stranded circular RNA it carries is folded into a rod-like form in its capsid. This allows host cell enzymes to use it in place of double-stranded DNA. Although blood is the primary reservoir for the hepatitis B virus, it can also be detected in milk, amniotic fluid, vaginal secretions, and semen. Therefore, infected blood can spread through sexual contact, contaminated needle injections, which is more prevalent among intravenous drug users, and contaminated blood from transfusions. The virus can also be transferred from an infected mother to the infant during delivery. Rarely, during the pregnancy, the virus can get past the placental barrier, which is a form of a very thin membrane that puts the mother's and baby blood extremely near and allows them to interchange various things including oxygen, IgG antibodies, waste products, and sadly some bacteria. More often than not, the intimate contact between an infected person's blood and secretions and the unborn kid allows the virus to be transferred from the adult to the child during childbirth. The ability of C-section to block this type of transmission is still unknown. If you have watched till here, don't forget to subscribe to Family of Science Lovers. Press the bell icon button so you are always updated. The hepatitis D virus only infects people who already have an active case of hepatitis B, but it spreads in the same manner. Now, the liver is the target of both of these viruses. Hepatic lobules are the functional components that make up the liver. Hepatocytes are the primary cells. They absorb and eliminate toxic substances like alcohol and drugs, assist in regulating blood sugar, synthesis a number of vital proteins, including albumin and coagulation factors, store specific vitamins and minerals, and transform cholesterol into bile salts, which are combined with water and bilirubin to form bile. If you have watched till here, don't forget to subscribe to Family of Science Lovers. Press the bell icon button so you are always updated. By merging its membrane with the cell membrane and releasing the capsid into the cell, the hepatitis B virus penetrates hepatocytes. The viral DNA's shorter strand is extended by the cell's polymerase, resulting in the formation of a full double-stranded DNA with the long strand. It next makes its way to the nucleus. It is then translated into many mRNAs by the transcription elements of the cell. These mRNAs exit the nucleus and use the ribosomes of the cell to produce viral proteins including DNA polymerase and antigens such as HBs, HB core, and HBe antigen. The viral DNA polymerase replicates viral DNA by using the biggest mRNA. Antigens from viruses HBs and HB core are assembled into new viral particles. But instead of being a component of the viral particle, HBe exits the cell and is present in serum. Partially double-stranded DNA is obtained by the virus as a result of the replication of the viral DNA being paused at the same time as it is packed into a capsid. The infection can linger for a long period without harming the liver because the capsid is then encapsulated and released without causing damage to the cell. The body's immune system is the real source of the harm. If you have watched till here, don't forget to subscribe to Family of Science Lovers. Press the bell icon button so you are always updated. B cells respond to the virus in the circulation and release antibodies against Hep B antigens. T cells locate and destroy infected hepatocytes, causing damage to the liver. Jaundice is a yellowish pigmentation of the skin, mucosa, and whites of the eyes that results from the release of bilirubin and bile salts from the damaged cells into the circulation and impregnation of the tissue. The bile salts enter into the skin and cause itching. The kidneys filter the bilirubin from the blood, which ends up in the urine rather than the stool and turns the urine black and the feces pale. Chronic hepatitis may result from either an inadequate T-cell response or from high HB's antigen binding to neutralizing antibodies. About 5 to 10% of cases of acute hepatitis B progress to chronic disease. Liver failure, cirrhosis, and scarring can occasionally result from liver injury. Hepatocellular carcinoma, a kind of liver cancer, is also more common in those with chronic hepatitis. If you have watched till here, don't forget to subscribe to Family of Science Lovers. Press the bell icon button so you are always updated. In the same manner, the hepatitis D virus reaches both the cell and the nucleus. Nevertheless, it copies itself using the RNA polymerase of the host cell and produces delta antigens using the ribosomes of the cell. The capsid contains the viral RNA, but for the virus to form a whole particle, it has to encase itself in the HB antigen. After then, it exits the cell. Now, unlike Hep B, Hep D directly affects the cells due to the damaging effects of delta antigens, which lead to cell death and liver damage. There are two ways that the Hep D virus might cause acute hepatitis. There are two types of liver infections: co-infection with Hep B, which occurs when the two viruses infect the liver simultaneously, and superinfection, which occurs when Hep D infects people who have chronic hepatitis B, which is a more serious infection. The Hep B infection becomes more severe due to Hep D. When brain function is compromised, these people are more susceptible to fulminant hepatitis, extensive liver necrosis, and hepatic encephalopathy. Hep B takes a lengthy time to incubate. 1. 6 months, on average 2, 3 months. Approximately 2/3 of those afflicted experience mild, asymptomatic acute hepatitis, which is typically undiagnosed. The preicteric phase of symptomatic hepatitis typically begins with fever, exhaustion, bodily pains, and nausea. After a few days to a week, the icteric phase, which is characterized by jaundice and black urine, comes next. The recuperation period begins after 1 to 2 weeks on average. Rarely, fulminant hepatitis with liver failure can occur in a person. This condition is often characterized by an abrupt increase in body temperature, nausea, vomiting, jaundice, disorientation, and possibly coma. The symptoms of chronic hepatitis B are usually milder than those of acute hepatitis B. Based on the antigen and antibody results in the blood, Hep B or B and D co-infection is diagnosed. The first antigen to show up is HBs, which can be seen in the first 1 to 2 weeks following exposure. HB antigen soon follows but disappears rapidly. HB antibodies show up soon after it clears. Anti-HB core IgM antibodies often manifest 1 or 2 weeks prior to the onset of symptoms, with anti-HB core IgG antibodies following a few weeks later. Anti-HB's antibodies develop when the patient heals. DNA from hepatitis B can be found at any stage of the illness. Currently, anti-HB core IgM, HBs antigen, HBe antigen, and viral DNA may be detected in acute hepatitis B infection. HB core IgG is typically detectable, contingent on the testing window. Anti-HB core IgM and anti-HB antibodies are the only ones that may be found during the window phase, also known as the recovery period. If you have watched till here, don't forget to subscribe to Family of Science Lovers. Press the bell icon button so you are always updated. Anti-HB core IgM is negative in chronic hepatitis B, although anti-HB core IgG antibodies, HB's antigen, and viral DNA can all be found for more than 6 months. There may also be HB antibodies and antigens. The indicator of healed hepatitis is the anti-HB core IgG antibody. There can also be antigens, anti-HB core IgM, and viral DNA, but only anti-HBs and HBe antibodies. During active acute and chronic infections, serum alanine and aspartate aminotransferase, or ALT, and AST are raised. However, ALT is elevated more than AST. Lastly, the only antibodies detected in vaccinated people are anti-HBs antibodies. To assess the damage and confirm the diagnosis of chronic hepatitis B, a liver biopsy can be performed. Typically, it displays ground glass hepatocytes, which are hepatocytes with granular cytoplasm. Hepatitis D and B co-infection superinfection may be suspected in severe instances. The suspicion is confirmed by the detection of anti-hepatitis D antibodies, delta antigen, or hepatitis D RNA. Treatment for an acute hepatitis B infection is typically not necessary. Immune system modulators such as pegylated interferon and interferon alpha are used in combination with antiviral medications to treat severe instances of fulminant and chronic hepatitis. Prevention is key when it comes to hepatitis B. Donated blood is tested for hepatitis B in order to stop the infection from spreading. People can choose not to engage in activities such as unprotected sex and intravenous drug use that increase their risk of infection. Lastly, vaccination against the illness is an option for high-risk persons, such as those receiving dialysis, those with many sexual partners, newborns whose mothers have chronic hepatitis B, intravenous drug users, and medical professionals, among others. Hepatitis B immune globulin, however, can be administered within a week after exposure if the person is exposed to the virus in order to avoid illness. For hepatitis D, there is no particular medication. Treatment and prevention of hepatitis B shields against the hepatitis D virus, since it is reliant on hepatitis B. All right, to quickly review, the DNA hepatitis B virus infects liver cells to produce acute or chronic hepatitis. The immune system is responsible for the damage. The virus can be spread by blood, sexual contact, or birth. Fever, lethargy, pains in the body, and nausea are the first signs of acute hepatitis. Jaundice follows. Severe fulminant hepatitis is an uncommon side effect. Though less severe, chronic hepatitis raises the risk of hepatocellular cancer and presents with comparable symptoms. The clinical history, antigen, and antibody results are used to make the diagnosis. Both immunization and abstaining from dangerous conduct can help prevent it. Interferons and antiviral medications can be used to treat severe instances of acute hepatitis, but no therapy is typically necessary for chronic hepatitis. Similar to the hepatitis B virus, hepatitis D is also an RNA virus. It only spreads to those who already have an active case of hepatitis B and heightens the risk and severity of fulminant hepatitis. Results from antibodies and antigens are used to diagnose it. Since treating and avoiding hepatitis B also cures hepatitis D, no particular care is needed.